It's a pretty simple name, Boston Senior Home Care, caring for seniors in their home. Simple, right? But what happens when going to a home becomes life-threatening? When connection gives way to isolation? When routine is replaced by unknown? COVID-19 stopped the world, but our world still needed care. Tonight, you'll meet organizations and individuals who navigated the waters of a worldwide pandemic, not just to do their job, but to carry out their mission, ensuring that all those that we serve are safe, healthy, and treated with dignity. Welcome to Forever at Home.
Now, as you know, Forever at Home is Boston Senior Home Care's annual fundraising event, and it's really important. While we wish, like I said, that we could all be together this year, you're going to enjoy tonight's event because it's very special as we honor our COVID heroes and partners. Who are they? Well, we're going to tell you. You're going to find out about some of the amazing people who have not only changed lives during this horrible experience, but they've saved lives. They've helped people get food. They've helped people get shots. They've helped people get company. They've just helped people. We're going to talk about that tonight with my friend and CEO of Boston Senior Home Care, Meg Hogan. I so appreciate everything that you all do, and I'm so thrilled to stand with you. And you have had some, it's not even a year, it's been more than a year, almost a year and a half now.
Yeah, it's been about 18 months.
Wow. But it's important to emphasize and to introduce some of the real heroes and the other people, your partners.
Yes.
And let's talk about that.
That's great, because I know that a lot of you out there this evening, you're here to support Boston Senior Home Care, which we truly appreciate. I also know you're here to support your colleagues who are being honored tonight, and I have to tell you, it is well deserved. We have our COVID heroes, which we want to honor, and that is the Age Strong Commission, it's the Boston Housing Authority, and it's Maloney Properties. Really nice to see that we could partner together. Let's face it, COVID, is there anything more grim? Was there a more scary time that was out there? And yet, if there was a glimmer of light, it was the fact that we could all come together and that we could partner and say, we're going to get through this. We are going to make sure that we meet the needs of our older adults, of disabled adults, of those that are the most vulnerable in our population. And that's what we're going to do tonight. Now, I don't want to forget our COVID partners because we do want to highlight their work as well. And that is PelMed Pharmacy, it's Suburban Home Healthcare, and it's East Boston Community Development Corporation. So we want to highlight their work as well because all of us at one point in time or more really came together and did great work in a partnership.
And going back to the heroes, Age Strong, you mentioned Age Strong. Huge, remarkable stories from Age Strong. Tell us a little bit about that.
So Age Strong was a great partner. They did an enormous amount. For example, when we were doing food delivery, we partnered with them because they were able to get fresh produce. So we said, great, let's hook up. We can get the boots on the ground. We've got staff who can deliver the groceries if you can get us the food. When we were doing clinics, for example, at Tufts Medical Center, suddenly within a few days, we ended up calling a lot of people to get them there because Age Strong put that together. I remember Emily Shea, who's the commissioner, she and I would be talking at 9 o'clock Saturday night, we'd be talking at 7 o'clock Sunday morning, because the goal is to get those slots filled to make sure not only that they were there, but how are they going to get there? Can we get transportation? Do they need a companion? Do we need to hook up someone because they can't really go by themselves? So again, this was a very strong partnership, and it kind of echoed through the pandemic in terms of the work that we did with them.
The Age Strong Commission is the Council on Aging and the Area Agency on Aging for Boston. So we work with Boston residents over the age of 60. We help to give them information and also help with things like benefits, transportation, volunteer programs. When COVID hit, people's emergency needs rose to the top. So the need for food, the need for accessing their medication, the need for social connection. In the past, we were out in the community, we were engaging with people in the office and over the phone, and we went to almost all over the phone, so we were just flooded with calls. At one point during the pandemic, we had close to 800 calls coming in our office a week. In our office, to manage the calls, we set up a call center, and we were able to get all of our staff trained on the call center. They were fantastic. We also partnered with many different partners, including Boston Senior Home Care, the Mayor's Office of Food Access. We had a food team from the BPDA, so many different food partners, About Fresh and Ethos and Central Boston. We had a team of volunteers that was packing food from the Greater Boston Food Bank, so it would get delivered in big containers. A little later in the pandemic, we were able to partner with About Fresh and all of their partners to be able to contract out for food to be delivered to people's homes. So we set up a specialized team in our office that was just focused on vaccines. We created an intake form to handle all of the calls coming into our office, and then our vaccine team, made up of people that spoke all different languages, would call folks back and help them to register for the vaccine. In the end, we ended up connecting about 3,600 older Boston residents to vaccines. When I was notified of this award, the first thing I thought of is, my team really deserves this. They worked day in and day out. Front and center in our minds is Boston's older residents and how we support them. And that's what people were thinking about throughout the pandemic, and that's what they were working towards. And so I can't say enough about my team and, frankly, all of our partners, our aging services partners throughout the city. We've received many cards and many thank yous for the work that we did. But I was looking back at this one card in particular about our food box program, and the food box program had a lot of vegetables in the box, a lot of fresh produce. And she said she shared the food with her sister, and she said, I'm from the South and I'm from the country, and we know fresh produce when we see it. And it was so, for her, to be able to get fresh produce instead of using canned produce. And it's the kind of produce that she grew up eating, and meant a lot to her to have that throughout the pandemic.
Congratulations to Age Strong. What a remarkable organization. What a remarkable story, Meg. I mean, to think something as simple as a fresh apple or a vegetable that we take for granted, and they made that happen for so many people. Congratulations again and again and again, and also thank you.
Yeah, they were terrific to work with. They opened doors for us, for example, when we were trying to get the vaccination out, and we were trying to contact multiple housing sites, and I'd reach out to Emily and say, look, I know it's in 4 days and I can't reach the person. We tag team, she'd reach out. The next thing I knew, they'd call so that we could make sure and get those vaccines done. So yeah, they've been amazing. They were an amazing partner, and they did just such incredible work during the pandemic.
Truly, COVID heroes.
Yeah.
Truly. And they're not alone. I mean, frankly, folks, we could be on this video for hours, for days, thanking everybody. It was probably really hard for you to pick the people who, we were going to spend time tonight honoring, because there were so many people. But I know that the city of Boston, in many ways, in different organizations and agencies within the city, really stepped up.
Yeah, they really did.
And so another hero.
Another hero would be the Boston Housing Authority.
Yeah.
And that's where, actually, they helped in both instances. They really helped us to set up at the buildings when we had said, hey, we can bring in pounds and pounds of groceries, but is it okay? Can we get tables set up? Because it might be on Saturday, and who's going to be there, and the doors are locked. So they were very helpful in terms of making sure and supporting us in getting the food delivery done. They did a lot of their own food delivery, I have to say. So this was a partnership in that light. But also during the vaccinations, we worked very closely because, of course, they're overseeing all of these supportive housing and community housing sites. They just did an outstanding job of pulling all those together. I mean, it was, again, it's really hard to explain to people how fast and furious all of this happened. You know, it's Sunday and you're good, and then it's Monday and they're saying, hey, you know, we're going to be wanting to do vaccine clinics on Thursday, and can you get 24 staff set up for that? And they just work so hard to make sure that all of that happens.
Yeah,
So,
and by the way, people aren't supposed to congregate,
Right.
and we can't do a big
Exactly.
group. We
Right.
can't say, come on down to room, you know, to the conference room, and everybody,
Right.
I mean,
Right.
it's overwhelming.
Yeah,
just
really
thinking
is.
about it.
It is. You know, and speaking of that, really trying to address the issues. Now, this is the population you're already talking about that are suffering from isolation, from related depression from isolation, and now you've got lockdown. They can't even go to a community room and, you know, congregate together and visit and so on. So I think that was the other piece that Boston Housing Authority worked with us on, is really trying to make sure that we were doing things, even if it was virtually, to try and engage people. And I know they themselves did a lot around that as well.
So life before COVID was very busy in supportive services. There was a lot of socializing between residents. There were a lot of programming. And then COVID came and it all came to an abrupt halt.
At the Boston Housing Authority, a lot of the conditions that were really lifted up under COVID existed previously. We had a lot of food insecurity. We had a lot of mental health and physical health needs. They have average income of about $15,000 per household.
The biggest challenges were to make sure the residents were okay.
We're a large public agency with 800 employees. We're kind of a cruise ship. We're not a jet ski. And so literally overnight, we had to respond.
All of a sudden, all bets are off about how you can keep people safe. What kind of restrictions did we have to place on our residents? What kind of restrictions would we place on our employees?
We went to kind of addressing the most urgent needs, and that included food. It also included wellness checks for elders, and in partnership with Boston Senior Home Care and the Age Strong Commission and other partners, we very quickly set up an infrastructure to reach out to all of our elders and check on them.
I was really struck with how important our decision to do the vaccine clinics on site was for so many of our residents.
There was a lot of hand-holding. We walked up to the vaccinator tables with some residents, like holding their hands, and they're shaking. But they're still happy. And then once it's over, they're like, oh, I could barely feel that. That was it. You know.
In that way, we managed to get a lot more people vaccinated, because otherwise they could not have navigated the system at all.
I was incredibly proud of the way that BHA folks stepped forward and just took on the challenge. And they, you know, these are folks that are working on the front lines. They're going into housing developments. They're there to serve residents. They didn't get to go home. They didn't get to work remote. I mean, some of our central office folks went home. Our site staff stayed the entire time. And so, yeah, I really worried for them. And we had to ensure that we were refining our protocols every week for how to keep our employees safe. But I think it's really important that we remember that, you know, this is a population that had a lot of needs pre-COVID, and we've really failed them if post-COVID we just go back to the way things were.
Boston Housing Authority really has always done, continues to do a remarkable job. And frankly, folks, it is thanks to all of their staff and volunteers, as you just heard, but it's also thanks to you.
They
and
really
we have
are.
another hero that we want to highlight tonight, Maloney Properties.
Right. So Maloney Properties had approached us. This was the point in time when the vaccine clinics were really starting to become up and running, and they had some enormous buildings. You know, it's one thing when you go in and there's 40 apartments or 80 apartments. You know, they were in the hundreds in terms of, I want to say one building we did had around 254 residents in it, and they desperately needed help. I mean, that is, to your point, you don't want people congregating, but you want to make sure they come down. You want to make sure they're secure. And we're also dealing with multiple languages. So you'll hear from Natalie, who would call us and say, oh, do you have someone who speaks this language or that language? And can you get that by tomorrow? Yeah. Because our person can't make it that speaks that language. And it was just a great partnership because you just go, yes, and then you go, okay, how are we going to do that? But again, you know, our staff at Boston Senior Home Care were phenomenal. I would write and say, I'm really sorry, it's Saturday morning, can you make it out to East, you know? So it and really worked out, and they did. And they did.
From the work side, prior to COVID, it was our standard working to keep our residents safe and happy and healthy. It was a storm that we were not expecting, and I think we're not prepared for.
Everything changed. Everything changed upside down. I think one of the hardest part is the fact that people were unable to actually come to your office or make an appointment and see you, to talk to you.
The challenges are that we have a highly vulnerable population that we work with. We work with seniors, we work with individuals with disabilities, we work with folks who are immunocompromised.
So we were meeting at least once a week in order to come up with different solutions and different way to reach out to the resident.
I think the safety part was the most scary for us, is making sure we could keep everybody safe, knowing they were in our hands.
Everyone would become a family and work together as a team to see what we can do. We buy food, we do the shopping, deliver medication, we picked it up. We come up with different ideas of getting credit cards and ordering online and have it delivered.
We have so many amazing partners and team players. We were reaching out to the Age Strong Commission. We were reaching out to Boston Senior Home Care and saying, can you help us? You know, do you have people that can come? Everybody was focused on the same goal, which is we have to keep people safe and we have to try to get this under control.
We know that there were a lot of group of people that didn't want to take the vaccine. As I was going through the receipts and trying to sort things and put everything into the system, and then to see their name on the list and to see them here today, it's a proud moment to smile about. So I'm very proud of that accomplishment.
Husband and wife, been living in the building since 2004, in their late 70s, and the wife contracted COVID and ended up in the hospital. He could not see her, he could not communicate with her, and we got word that she was dying. And so we called the Age Strong Commission, Emily Shea, and said, Emily, can you help? This is the circumstance. She said, I think we can figure it out, and got the city to donate a tablet. The resident services coordinator, Javona, picked up the tablet, she got it programmed, and they were able to continue to communicate while she was in this process of dying. And the miraculous thing is that she survived. And they really think that this has to do with the fact that she had contact with her husband. They could see each other, they could talk to each other. So it demonstrates how important it is for us to have each other in relationships. Like when everything else falls away, it's that human contact and connection that makes the difference. So that for me, it was like, I'm so glad we could be part of that, you know, that we could help.
Wow. Well, I think I'm going to need to take a little break. What a story. Oh, my goodness.
Yeah.
And the best part is it has a happy ending.
Right.
It had a happy ending because everybody at Maloney Properties and the city and your folks all got together and they made that happy ending happen. Wow. The two of them obviously have been through a lot.
Right. You know, I'm glad that they shared that story because it's been truly hard.
It has been hard. I mean, that's what this is all about. I mean, it's you put names and faces and experiences. And you know what, folks? I'm not going to apologize for getting a little misty here. I mean, it's been really hard, Megan. It's been really hard for you folks who've been in the front lines. And now we're going to talk about some of your COVID partners because, you know, no matter who you talk to, this is one of the things I love about all of you. you say, congratulations, you did a great job. And no matter who you're talking to, they say, it wasn't me, it wasn't just our organization,
Right.
it was everybody, it was a
Right.
team, it was the universe. And I know you had a lot of partners, so let's
We did.
spotlight your partners.
So I've talked a lot about Mike Roper
Yeah.
in Suburban Home Healthcare. As I said, he was just amazing. He helped us, whether it was food delivery, but he also was able to get it so that his group could offer vaccinations. So we were able to partner with him and our other COVID partner, PelMed Pharmacy, so that they could come together and do vaccinations in different sites. Because what was happening is that as the vaccination became more widespread, it actually became difficult to find pharmacists who would be available to do this. So between Mike Roper and Suburban and PelMed, they both came through for us. We were able to book things ahead, so we had more than 3 days, which was always terrific at this point. And again, we were able to go to South Cove apartment complex or other complexes and know that people didn't have to go out, but they could do the vaccinations there.
And you said before something that's so important, and anytime you call Mike, you say, Mike, can I ask you something? And he always says yes.
Right.
Before you've even asked for what it
Right.
is. So, Mike, I hope you're watching tonight, and I know a lot of your friends and relatives are too, so huge thank you.
It was challenging because at the beginning they're afraid of COVID. They don't really want the nurses to come in. They're just afraid that the nurse might carry COVID and they might contract it.
A lot of these patients are in elderly buildings which have like hundreds of elders in there. So we had to make sure that we were seeing the patients, keeping them safe, keeping us safe, and then minimizing the spread of the virus as well.
We start at the beginning getting our clinician vaccinated, and then the home health aides, and then later on we work with Boston Senior Home Care to get the residents in Boston to get vaccinated as well.
When you get into the patient's house, you're actually looking at the whole patient. You're looking at their financial aspect, their social aspect, their home environment. Are they safe? Do they have food? So some of those things we can control. We can take care of the medical needs and we can take care of some personal care items, but a lot of the things we cannot do, Boston Senior Home Care really comes into play by providing PCAs, Meals on Wheels, shopping assistance. Those are some of the things that we can't always provide, especially on a skilled Medicare case where we can't stay in there long term. So Boston Senior Home Care really picks up where we leave off as far as where our care goes, and we want to make sure that there's good continuity of care, and Boston Senior Home Care really helps us out in that respect.
That was nice.
Yeah.
And it's so true. I mean, Boston Senior Home Care does it all every day, 24/7, and that's really the message that I hope everybody is getting as we're explaining what you've been through the last 18 months. It's just mind-blowing, mind-boggling.
And I think, when you hear what that gentleman said, what's really important is that very smooth and warm handoff. So, one person isn't going in a silo and then they disappear and then Boston Senior Home Care's up. No, we're working together. We're having conversations. We're saying, how did it go when you were in there? What are the things that you assess that they need? How can we best serve that person? And of course we go in and do an assessment, but it just makes a world of difference to have a partner like Suburban.
It's the continuity of care.
Exactly.
And there are so many different aspects of it, as we've talked about tonight.
Right.
So another important partner, East Boston Community Development Corporation.
It's a mouthful.
It's a lot of words. Tell us a little bit about how you partnered with them.
They were another group that has a number of community housing sites, and we overlap because that's a lot of our consumers live in that territory. And so Jeff Buono reached out and said, hey, can you help us? Because we've got sites all over and we just really need the support to be able to distribute the vaccination. So of course we stepped up and we said yes. Now, we were more than happy to help, but there were some just terrific stories that came out around the consumers being able to actually have a social interchange now. There was one building, they have barns that was a school. And when I was there, it was on a Saturday, so leadership at Boston Senior always tried to do the weekend so staff did not have to. And the consumers and the residents that we were talking to were telling tales, they were telling stories, and one said, I went to school here. Oh. And another chirped up and said, I went to school here. So these people that, actually this is their school environment, we're in there where they would have held plays, because there's a nice stage there and everything. They're saying, yeah, I went to school here and now this is my home. So it was just such a compelling moment in time to be able to say, this is kind of astounding.
Yeah.
But they were, East Boston was a terrific partner. Jeff and Lisa, who ran the buildings, just did an amazing job to make sure that the residents were comfortable, they got their shots, they were able to do a bit of socialization and then move on.
Well, normal, we run about 700 units. A normal, typical day, we handle our work orders, interact with the residents. We have, meetings and community and gatherings. We'll have lunches and barbecues and everything like that we do, and yoga classes and exercise classes. Then COVID hit, and we basically, since we dealt with the frail elderly, which was the highest priority, we had to stop interacting. I had to send my managers home. My maintenance crew only went in for emergencies to do work orders, if they even could. The biggest challenges was actually giving the care and taking care of their apartments every day. Every day was a challenge of how to get in there and not expose them to us. Emily Shea, through the AIDS Commission, and she hooked me up with Boston Senior Home Care. They started partnering us with this clinic world of what we could start doing. And we also worked with them on some food issues. Some of my managers did reach out to them and talked about getting some food deliveries. But I worked directly with the Boston Senior Home Care for my clinics, for the COVID clinics. So for the clinics, obviously with the federal program, we partnered with CVS. And Boston Senior Home Care was in touch with me right at the very beginning of that program coming out to how we can organize it, what I needed, what supplies I need just to run the clinic, the PPE stuff, the pens, notebooks, just papers, ideas, how to run it, keep people safe was massive. I did it on 5 different properties. So how to run it every day was what I talked to them about almost consistently. Every few days I think we talked till I got that clinic signed up. I think what you learn is, from my world, from my job side is one thing, but my job world, we learned seeing these people every day, it has an impact on you. They impacted our life every single day. And seeing them go through this was tough, and seeing them being stuck in their house and see people's mental states changing, we weren't ready for it. So I think for us, in terms of us, as we're coming back out of this, I think we want to put more into the properties to help take care of them and give them what they need again and bring it all back as soon as we possibly can, the safest way. But I think that's what it does. And personally what it does is it brings you closer to people you love and care about.
We did redefine a lot of terms in the last 18 months through COVID, and boy, family is one of them. Family no longer means that you have to be related by blood. There are a number of ways that you can be related and connected to people, and what a great example we have here.
Indeed.
So Meg, another one of your partners, PelMeds, you've mentioned them many times. Explain to people why they're so important.
That was important because at that point in time, it was getting more and more difficult for pharmacists to be available to give the COVID vaccination shots. So, it was kind of a conundrum because one, you were seeing the actual dosages were limited, but at the same time, trying to find someone to come into the buildings. And again, it was so important that we could bring that vaccination to our older adults, to individuals with disabilities, so they weren't trying to navigate Gillette or Fenway. And there was PelMed, and PelMed was amazing. They were another can do, yes, we'll be there, when can it happen? And we also, again, I think I'd mentioned, we got the luxury of having more than 3 days to plan, because then we knew, okay, we've got a couple of weeks, we know they're going to be there, and they just became such a terrific partner through this whole process.
So we're a pharmacy based on packaging and delivering medications to those that can't afford or can't go to a drugstore. So once COVID came and the vaccine arrived, we're asked to help the state vaccinate all those in congregate care. The issue was that they couldn't get to mass vaccination sites such as a Gillette or a Fenway Park for multiple reasons. One being transportation and access, and two, more importantly, because of the fact that they were high risk. So we made it our goal to get as many folks in these types of settings vaccinated as soon as possible. I was matched up through the Boston Housing Authority with some of the buildings in the city of Boston, and through that I was able to partner with Boston Senior Home Care to help facilitate that. They were a great partner to work with. They provided the space, they organized the staff to help residents come down to a main area to get vaccinated. They helped us with all of the logistics and vice versa. We would go in, set up a time for the clinic, and they would have the staff assist us in getting the residents down to get vaccinated. And then, with the vaccine, it was a two-step process. So 3 weeks later, they had coordinated the schedule for the time, as well as making sure the staff and the residents were available to make sure that they got their vaccines. We are working with them to not only just do boosters, but flu vaccines, and also other ideas that we have come up with in helping with patient care.
Meg, to you and your staff, you are remarkable. And for the hundreds of thousands probably of lives that you have touched and will continue to touch, I'm going to be the person for all those people who says, thank you.
Thank you. And thank you again for joining us, Susan. It's always a pleasure.
I'm so proud to stand with you. Thanks, folks. Good night.